Next up, it is my great privilege to introduce HRSA Administrator Carol Johnson. Administrator Johnson previously served on the White House COVID-19 response team and on the Domestic Policy Council. She also is Commissioner of the New Jersey Department of Human Services, and she has spent many years on Capitol Hill as a health staff member for committees in both the House and the Senate. Administrator Johnson has helped expand Medicaid coverage for mental health and substance use disorder, and has created new Medicaid benefits to improve maternal health outcomes. So with Administrator Johnson, we have a real champion for maternal health. Thank you and welcome, Administrator Johnson.
Oh, thank you so much, Adrienne, and thank you to the Alliance for your leadership and for organizing today's event, to Representative Berrigan for your leadership and for really demonstrating leadership on the Hill on this important issue. And to my colleague, Rachel Pryor, this is but a testament to her commitment to these issues. I imagine if she had no voice, she would still have been here today holding up signs, trying to tell you how strongly she feels about these issues and how hard she and Secretary Becerra are working to address maternal mental health issues. And thank you also to all of you on the line today. I know that this has been a years-long fight for so many of you, and you have been in this work for a very long time trying to address this critically important area. And as Rachel said, we really do think it's a pivot point. It is a moment where the president has identified mental health needs as a key priority for all of us across the administration. The secretary has challenged us as agency leaders to lean in and pull all levers to address these critical issues. At the same time, we are getting the same charge when it comes to maternal health. So as Rachel said, really the convergence of our priority work on maternal health issues and on mental health issues make this a uniquely critical time and opportunity for us to do all that we possibly can to support birthing parents and new parents. As folks mentioned, I'm Carol Johnson. I'm the administrator of the Health Resources and Services Administration. We think of ourselves as sort of the equity agency, and HHS is really focused on delivering healthcare services in historically underserved communities, in under-resourced communities, in rural areas. We run the Community Health Center program that provides primary care services, including prenatal services, in communities across the country, serving almost 30 million people. We are the Ryan White HIV program that serves another 500,000 people. We are the agency that supports rural health clinics across the country, but we also are the Title V maternal and child health programs. We run the block grant that funds states' maternal and child health services. And through that work, we touch almost every child born in the country, newborn screening, a host of services, that early intervention services, as well as perinatal services. And so we are uniquely positioned, we think, to be at the front lines of this battle, because in addition to all of that work, we also are the federal agency that funds, that receives discretionary appropriation resources from Congress to support growing the workforce. And increasingly, those resources are focused on growing the behavioral health workforce. And so we have a real opportunity here to think about both the policy interventions, the way we can fund and support state interventions, and the way that we are building out the healthcare workforce. And so as Representative Berrigan mentioned earlier, we just recently launched on Mother's Day the National Maternal Mental Health Hotline, which is 833-9 HELP for Moms. HELP4MOMS, which is a 24/7 confidential access line to help provide the opportunity for pregnant individuals and for new mothers to get direct access to trained resources to be able to help address mental health challenges like depression and anxiety, to help ensure that people know how to get connected to help in their communities. So we are excited to get that up and running. We think we have commitments in the president's budget to continue to grow the capacity of that line and make sure that it is as strong as possible a resource to communities everywhere. At the same time, we also have the opportunity, and an opportunity that has grown with the president's commitment through the American Rescue Plan, to support a program that has a very long title called Screening and Treatment for Maternal Depression and Related Behavioral Health Disorders. And so while it has a very long title, it has a very simple concept, which is that we need to be working to ensure that we're training maternal health providers in identifying mental health conditions and being able to ensure that they can support their patients who have mental health conditions. And that means helping maternal health providers with the best supports possible, including training, but not just leaving maternal health providers then to sort of figure it out for themselves. What we've created through this program are access to teleconsultation services for OBGYNs and certified nurse midwives and others to be able to have direct access in real time to perinatal psychiatrists, licensed clinical social workers, other team support to be able to help them address the needs of their patients. And not necessarily, we have terrific anecdotes about this program, about how it has been able to allow OBGYNs and others to not have to refer someone weeks later to and hours away to a mental health provider, but being able to bring that support real time into maternal health providers' offices. So we look forward to continuing to grow that program. We think it is part and parcel of the way we're going to continue to do our work here to contribute to the overall efforts that everyone on this line has been working towards. And then finally, I'll just mention that the president's budget, as part of his significant commitment and the secretary's prioritization of really working on behavioral health issues, there is a significant investment proposed in the fiscal year 23 budget for us to grow the behavioral health workforce. And we think about that not just as training more mental health providers, but also training the critical community connectors, like community health workers, like doulas, like peer supports, like people with lived experience, to be able to engage people in care. You all know this better than I do, that that's the critical front door. Getting people into care and then helping to retain people in care is so often contingent on really having community-based supports that reflect the community that people live, that are trusted messengers, that can help bring people into mental health services. So we're excited about doing this work with you going forward. We are taking up the president and the secretary's charge, and we look forward to your partnership in the days and weeks ahead. Back to you, Adrienne.
Thank you so much, Administrator Johnson. We really appreciate your sharing the information about those programs with us, and you really appreciate the administration's emphasis on maternal mental health and really recognizing that it is so important. Moms, we all have moms. Moms are the heart and soul of the family. And if the mother's not doing well, then the family's not going to do well. So again, thank you for your time and thank you for your support.
Thank you.